Subramanian is doing, that he's trying to link up everybody. If it is transmitted appropriately, it can be done very easily. This year calendar takes approximately 12 games, which I have just forwarded, 12 games which can be just projected in form of a QR code as well, which can be scanned. Simple games which integrate all the 7, 5, 8, 11 senses so as to make it much more meaningful. So sensory integration is one fundamental which needs to be understood very well. That's one thing. The other thing is that all of you are listening to me. Even I am speaking to you. But I have issues. I may be having a headache. I may be having some issues, targets which I have to complete. I may be having so many things which I have to address. But what do? I keep all of them apart, bring in a blanket space or an empty workbench in my mind, in which I take in only those things which are essential to be addressed at this point of time. Synthesize them, speak it out, and then listen to what is being told, relate with my memory, and process the entire input in that workbench or the empty space. That empty space is known as working memory. So the second thing which I understand about autism is that this working memory is to be developed out. Very difficult, no? Very difficult. Even our working memory is very difficult. Chanchalahi mana Krishna, pramadhi vadabadritam. It's very difficult, Krishna, to control the mind. What to do? Krishna says, abhyasena tu kaunteya. We practice it only, then it happens. Abhyasena tu kaunteya vairagyan guhyate. Which means only with practice of therapy is again and again repetitive, again, you have to do it. So there is no other go to develop that working medicine. No medicine. Sorry, the working memory. No medicine for it. So therapy is something which is very essential and it should be structured. Sir told he did ABA. ABA is one fantastic thing in which you have to code out, okay, done, this response is done. So you code out exactly and quantify what is happening in therapy. So ABA is one other platform which should be taken up so that whatever we are doing is quantifiable. There are many more things which are to autism, but from a therapist perspective, these are a few things which are essential, fundamental to be understood when we work with children having autism. There are a set of games. If you can just project it, I'll just rush through that. Can you?
That has been shared
in the group. Fine. So nice of you. So, fine. It's a wonderful platform. Thank you, sir, for bringing us together. Let us be together. Let us nourish ourselves with our knowledge together. Sahana bhavatu, sahana ubhnattu. Let's increase our capability. Sahaviryam karavabhai. Let's our flare go up more and more. Tejasvina. Let it go more. Radhitamastu. Let there be no conflict amongst us. Professional boundaries should be respected. Mavid vishavahai. And let the balance of nature be there. Autism is a lifestyle disease. The air condition, the RO water which we are drinking, the pesticides which we are having, probably it lies there. So let's not disturb the balance of nature. Om Shanti, Shanti, Shanti.
Can I give that to my child? I haven't even, gone beyond telling them hello. The first sentence they asked me is, in the miracle Malar, can I give my child? Because I was told that will cure the child. And they are highly educated parents. So that's the expectations with which they come to our COE. So I'll have to dispel a lot of myths, tell them that autism is not something that we try to cure, or it cannot be cured. It cannot be fixed because it is a different way of functioning of the brain. So why do I give therapy? I give them therapy so that they can function fairly normally. They can function in a way which can make them useful to themselves and to the society, but we are not here to fix them. So initially what I would like to say is that autism is a diagnosis which should be accepted. It is not a life of challenges for them. It is not a roadblock for the parents, but it is a detour. They are going to reach the same end, but they're going to take a unique path. So that's one thing we have to tell them. Parents should be, encouraged, motivated, even for small wins. The parent can come and tell you, today my child said mummy. It will be a 5-year-old child whose first word is mummy. So don't tell them, be happy with them. Celebrating small wins is the way forward for our parents, because that's the way they are going to get encouraged. It might take 3 to 6 months for that particular development to happen. So that's up to us to encourage them. And I also think that it is transdisciplinary. Please don't take claims. because of my OT, because of my speech therapy. No, it's all of us together, all of us working together for that single goal. So we are now having group therapy on Saturdays where all the therapists work together with one goal, and we are transdisciplinary, as NIPMET taught us, is the way forward. No single person can claim that this child has become better because of us. Any myths, kindly, I request you, all therapists, don't please. Even now, I know that there are places which are promising cures, promising a shortcut, which is not at all possible. It can only happen if it is a structured program. And I'm sure that together we can make a difference. There's a whole lot of people waiting outside to be diagnosed, leave alone to start intervention. So I think it's high time that we all join together and did our best for these children. Thank you for the opportunity.
The shortest speech here. I think from A to Z, from 1 to infinity, we have all a combination of words. I think we are falling short of it. Okay, we express our thanks to each and every one of you here, dignitaries on dais, off dais, who are working backstage, all the blessings of our elders who are there with us, and of course the Almighty. With this, I conclude this the vote of thanks. All good things should not come to an end. It's going to start now. It's going to go on. Thank you.
I am Dr. J. Sundarapani, retired pediatric profession, practicing as a senior consultant in neurodevelopment disorders in Madurai, owing a complete setup about the neurodevelopment disorders. I have come to attend the conference and to know the latest updates.
We have a lot of plans for these nice conferences and nice organization. The whole platform was created, as I said, for ensuring we bring in people from different disciplines together and learn. Now we have ventured into training programs for various people. We are looking at filling the gap in the training that is happening, because rehabilitation is one area where we need to really work towards what is best for the child. We have to look at the outcomes that are relevant for the child and the family. We have to look at outcomes that matter. What outcomes matters is how the child or the person is able to participate. And that's where we are working at. And hence, we have decided to start a nice academy, and we are launching two important programs there. One is a fellowship for pediatricians on pediatric rehabilitation, and the other is a clinical finishing school of 3 months for rehabilitation specialists to work with children with various developmental issues. These two programs are in the annual and will be launched. One is starting in April 15th, the pediatric rehabilitation fellowship for pediatricians, and the other, the clinical training and finishing school for rehabilitation specialists is starting from June. So hopefully we'll be able to make a difference to the society.
Hi, good morning. என்னோடய பேர் பிரீத்தி. நான் வந்து இங்கே நிஷ்டா ஸ்மிருதியில் அட்மின் இன்சார்ஜாக இருக்கேன் இப்போது. இனிஷியலாக நான் வந்தது எப்படின்னா ஃப்ரெண்டஸ்க்குக்காக தான் வந்தேன். ஆனால் வந்து அதுக்கப்புறம் சார் வந்து இந்த மாதிரி ஈவெண்ட்ஸ் எல்லாம் ஸ்டார்ட் பண்ணும்போது நைஸில், அதே போல் நைஸில் வந்து நம்ம என்கோராக இருக்கட்டும், ஆட்கானாக இருக்கட்டும், இது எல்லாத்துலேயுமே வந்து ஸ்டார்ட் பண்ணிவிட்டு ஈவன் நம்ம ஸ்டார்ட் பண்ணது எப்படின்னா ப்ரமோஷன்லேருந்து, ஸோ ப்ரமோஷன்லேருந்து ரிஜிஸ்ட்ரேஷன்லேருந்து க்ளோசிங் ஏரியா வரைக்குமே ஃபுல்லாக வந்து சார் வந்து ட்ரெயின் பண்ணியிருக்காங்க. கிட்டத்தட்ட வந்து ஒரு 10 கான்ஃபரன்ஸ் நம்ம சக்ஸஸ்ஃபுல்லாக ரன் பண்ணியிருக்கோம் அப்படின்றத நினச்சாலே எங்களுக்கே ஒரு மிகைப்பாக இருக்குது.
Good morning, my name is Asmita and I am a research scholar in Sri Ramchandra Institute of Higher Education Research in Chennai, and I am doing my PhD in child development. I am just happy and excited because I have been to some conferences of Nishta in my MSc days, so I am happy to be here again. Actually, I have been to very less conferences, but most I have seen is the session is connected today. Bridging the gap from clinic and real life and RCTs. So this is a new way to look at therapy and interventions for autism and any other NDD diagnosis for that matter. It's a must witnessing event, and if at all anyone has chance to come to this conferences, any conferences in the future, we should not miss that. We have to get the opportunity whenever we have to go and see there.
I am Likith Ram from Bangalore, from Ramay College of Physiotherapy. I'm a pass out intern. from Ramay College of Physiotherapy.
Good to know you, sir. I have 3 questions to ask you.
Yeah.
The first thing is, with your facial expression, can you tell me how did you feel before coming to the conference and how do you feel after coming?
Excellent. Yeah, I would like to. Yes, excellent. I was very much excited for the moment for this because autism, when we speak about, there is no such thing exploring as such. So I would like to thank Subramanian sir and Hema ma'am as well, both for providing us this opportunity to explore the autism world. Initiation is more important, and also that this institution is trying to bring and it's actually teaching us the knowledge. The second most thing is applying to the real world. So that is the main thing here. So that is the I would like to highlight that point majorly. Yeah, again, excellent, out of words. Yeah, so that is the word that I can use. And also we don't see such these kind of conferences in Bangalore. Maybe we are expecting this conference to happen in Bangalore sometime later. So I would request Subramanian sir and Hema ma'am as well for this. Thank you.
I'm Hariharan. I'm consultant clinical psychologist and team lead at Smriti Healthcare. I'm here to attend this Autcon to learn from different professionals about autism.
I'm Kripa. I'm a speech therapist by profession. I'm an associate professor at Ramchandra, and I'm also associated with Vasant Thomas Special School. I think this is the 10th year I'm here at Autcon. Autcon, is here because we are here at Autcon because it's a conference where we have practical scenarios discussed, clinical related information that are discussed along with evidence-based practices.
Hi, I'm Nitya Raman and I'm a senior consultant speech language therapist at Nishta. We are here at Autcon because this is a fantastic platform for collaboration and updation of real-world evidence-based practices and strategies that we use in clinical practice. And I think this is a platform where we get to hear from expertises in various fields and just know what everybody is doing. I think the entire premise of this year's Autcon is to convert evidence-based practice into real-life clinical scenarios. So I think every session is hopefully doing full justice to that. And I think what we are learning here is how to use the clinical knowledge that we have and how do we take it to the community and how do we implement it at grassroots levels.
I'm from Savita College of Occupational Therapy doing currently Masters in Pediatrics. Other conference will be on specific topic carrying on here. Here everyone with every on their knowledge, they are sharing more knowledge about the pediatricians, occupational therapists, speech therapist, NIPMED and many universities over here are sharing their knowledge. So we'll be having a broad area of knowledge. As an healthcare professional, everyone should attend this conference to gain knowledge and to give an evidence-based practice to the kids and society.